International Association for the Study of Pain, IASP, has dedicated 2021 as the Global Year of Back Pain. As such, David Elvish from Workplace Physiotherapy will be myth-busting some treatments, talking about exercise and activities for back pain.
Hi, I'm David Elvish, Managing Director and a titled pain physiotherapist with Workplace Physiotherapy. We work closely with the team at Hunter Pain Specialists. My talk today is about myth-busting treatment, exercise and activity for back pain. What we know is that back pain is a very personal and individual experience, and that your recovery and journey will be very different to the next person. And what we find is that what assists you will be different probably to that next person as well. If we Google treatment for back pain, we come up with a myriad of options, and this is where it can be very confusing. But there are some commonalities that we do see with the group of people who respond more favourably. What we find with that group is they have greater expectations of a more favourable recovery. They have more confidence that they can continue with activity despite pain and not necessarily stop. They're generally less fearful of resuming daily activities. They have a greater understanding that a broader variety of factors ultimately contribute to the pain experience beyond actual tissue damage. And they have an acceptance that the pain experience can be heightened or diminished, irrespective of what is occurring at that tissue level. They generally have more regular and refreshing sleep. They have less feelings of being anxious and depressed. And generally they're associated with a practitioner involved that has similar beliefs, and encourage that it's okay for some of those feelings to be felt, and they're quite normal feelings to have. But there's really a sweet spot with these guys where many of the treatments really need to create a positive experience for that person. We know that treatment can vary with each person, and from that they can have a varying positive experience. When we put sometimes those treatments under a microscope, they probably don't look as favourable, but we know for the individual that they seem to have this. And that then leads probably to what we have with guidelines. What we know with treatment is often there isn't one treatment that helps with everyone. And we know that sometimes actually people get over-treated. We know that there's this general perception with back pain that people are overmanaged and overdiagnosed and overtreated. And sometimes that actually results in less favourable outcomes as a consequence of what's going on. We know that what's important to sleep, and probably what we look at when we see those commonalities with people recovering from back pain, is that those same consistencies with what we know that seems to work seems to be reflected in what we see with those people. So really ideally, a good treatment and a good treatment practitioner should be imbibing those qualities of really encouraging activity with movement, reducing the fear with movement, encouraging better quality of life and encouraging better sleep, and encouraging these people to resume activities in a really positive way. What we also know with treatment is really it doesn't need to be expensive. The most important treatment is the treatment that really empowers the person to take control and let them own their recovery. And we know that generally when that's being done and it's being done in a positive way, it results in a really favourable response to people. When we look beyond treatment and look at some other factors such as posture and exercise, we find some other interesting factors. So when we look at exercise with the management of back pain, really all the studies tell us that lots of different type of exercise tend to work with different people. So there's not one particular exercise that seems to be the solution to everyone. And again, probably when we look at the commonalities with that, probably what we're seeing is that the person that's actually having exercise that's encouraging them to remain active, giving them some guidance to actually resume activity, and giving them experiences to improve their qualities of life ultimately results in probably a more favourable outcome. But that will vary for people individually, and really what we need to be looking for is encouraging people to actually think of probably what works with them. We know that probably the most favourable treatment is the treatment where the practitioner is sitting down with the person and actually talking about what they feel provides them with the greatest benefit, what they think probably their expectations are going to be, and really then combining that into a really positive treatment effect. When we look at things like posture, it's one of the tricky things because probably typically most people think that to assist them with recovering from back pain, they really need to be adopting good postures. And partly what goes with that is then this belief that if you're not adopting good posture, then potentially that's actually going to result in some sort of harmful effect. But what the research actually tells us is probably there isn't a great correlation between posture and back pain, and certainly with recovering from back pain, and certainly even with preventing back pain as well. What I like to think of and flip that around a little bit is to think more from a positioning side. So rather than talking about posture, which I think comes with some connotations of static positioning and staying in the one spot for a while, I think when we talk about more positioning encourages more movement. So changing position, being a little bit more dynamic with what we do. And I think certainly when I talk to my patients, one of the things I try to encourage is that really we're thinking about more changing their positions. Our body's meant to move, our body's meant to be dynamic, and probably that's actually going to aid that recovery process as well. To have this really positive experience for patients. But again, if we can draw the commonalities from that, again, what we find is probably that if we encourage people to be active, if we encourage people to be less fearful of moving, if we encourage people to have some more positive expectations in regarding their recovery, that will actually result in some greater benefits. Lastly, the final point I want to talk about is manual handling and the link between back pain and manual handling and exercise and posture. So again, what we now realise is that we've spent a lot of our time, and I'm guilty with being involved in this or encouraging this approach, is that we've encouraged people to lift the right way or lift what we think is the right way, move in certain ways, push and pull in certain ways. But again, what the research is now telling us is there probably is no right or wrong way with that. And certainly there's no research to actually show that if you adopt ideal postures or better manual handling positions, that actually is going to make a difference to potentially resulting in recoveries and maybe even less likely to impact your recovery from the injury as well. What we do know is encouraging people to make their own choices for something that they feel confident with and feel comfortable with, that probably ultimately that's the best approach. So from a conclusion, hopefully what you've picked up from what I'm saying is that what's really valuable to people is to have that individual treatment experience. For the vast majority of people, they don't need treatment. They get better really quickly and they recover and they get back on with life. But for that group of people that do need treatment, probably what we're seeing with all the different treatments that are offered out there, the commonalities are that they're being empowered to take control of their recovery. They're being reassured that actually movement is okay and actually movement's going to be a solution to their problem. And they're being given confidence and being provided assistance to assist them with understanding that there is a nice, clear pathway. I look at that and I look at the role of the practitioner as actually more being a coach rather than a treater. I think the notion of being a treater falls into that passive approach where then the practitioner feels that they need to actually be providing the treatment to make that person better. But more often than not, the person's actually going to be the person that makes themselves better. So really, I think the role of the coach, the treater, the practitioner, is to be empowering that person to understand their recovery, to take control and to maximise that potential. So in conclusion, if I can just encourage that really probably the most valuable thing we know with back pain is to encourage people to remain active from the moment they have back pain, to rationalise that experience, to understand that probably the pain isn't always a direct relationship to the tissue damage or tissue injury that's occurred, and there's lots of other factors that contribute to that experience of pain and ultimately assist with their recovery. So really approaching a more holistic approach certainly seems to be far more favourable with these people, but really encouraging them to return to life, to return to good sleep, to be thinking about things that are actually valuable for them, and returning to that as quickly as possible has been shown to probably be the common factors with what we find with all treatment. Thank you.